Hi, my name is Carrie Duncan, and today I will be discussing the Phalen'sTest. In this presentation, I will give a background that will include its indication, some anatomy, the test procedure via video demonstration. As far as research, we will discuss a definition of research terms along with the evidence and also clinical relevance of these research with limitations and proposals for future research. The Phalen'sTest is a pain-provocative test used in the diagnosis of carpal tunnel syndrome. Many physicians will, however, confirm a diagnosis by using the gold standard nerve conduction velocity study. As we know, carpal tunnel syndrome occurs when the median nerve is compressed in the carpal tunnel. The nerve roots of the median nerve are from the ventral rami C6 through T1. It is derived from the brachial plexus, descending down the arm medially. The medial nerve is the only nerve that passes through the carpal tunnel. It provides motor function to the flexor compartment of the forearm, thenar, and intrinsic hand muscles. It also provides sensation to the palmar and distal dorsal aspects of the thumb, index, middle finger, and the radial half of the ring finger. In this test, you will bring the patient's arm up and bending the wrist maximally, ensuring that there is no space between the wrists. You will hold this test position for 1 minute. A positive test occurs when the patient experiences numbness over the thumb, index, middle, and half of the ring finger. Here's another view of the test. The patient brings their arm up and bends maximally, ensuring that there's no space between the dorsal aspects of the wrist. This is done to compress the median nerve maximally. In order to really understand the evidence, I'll first present and describe the definition of terms. The terms sensitivity and specificity are measures of validity or the agreement between a test and a gold standard. In our case, comparing the Phalen'sTest to the gold standard nerve conduction study. Sensitivity is the ability of the test to identify those with a disease. If the test is highly sensitive and the test result is negative, you can be nearly certain the individual does not have the disease. Specificity is the ability of the test to correctly identify those without the disease. If the result of a highly specific test is positive, you can be nearly certain the individual has the disease. Likelihood ratios use the sensitivity and specificity of the test to determine whether a test result usefully changes the probability that the condition exists. A likelihood ratio of greater than 1 indicates the test result is associated with the disease, whereas a likelihood ratio of less than 1 indicates the result is associated with the absence of the disease. Finally, the inter-examiner reliability, or kappa, describes the degree of agreement between multiple examiners. In the Netter's text, validity was found by comparing the Phalen'sTest to the gold standard nerve conduction velocity studies. This study observed 228 patients who were referred via consultation regarding carpal tunnel syndrome. The sensitivity was found to be 0.51, while the specificity was found to be 0.76. This means the test is better able to rule in a diagnosis of carpal tunnel syndrome. The likelihood ratios reflect a positive likelihood ratio of 2.13 and a negative likelihood ratio of 0.64, confirming that this may rule in a diagnosis of carpal tunnel. The kappa, or reliability score, of 0.79 indicates good reliability. Other articles have observed validity of the Phalen'sTest while comparing to other tests for carpal tunnel syndrome. A systematic review by McDermott et al. In 2004 reviewed 60 articles to observe validity of carpal tunnel tests such as Phalen's, Tunnel's, and the carpal compression test. The most frequently used or frequently studied test was the Phalen'sTest, where the average sensitivity was 0.68 and the average specificity was 0.86. Another interesting study by LaJoy et al. In 2015 used latent class analysis to account for errors that can occur when comparing to a gold standard. It measured the Tinel sign, the Phalen'sTest, and nerve conduction velocity test. The results of this study showed both Tinel's and Phalenes to be both highly sensitive with a score of 0.97 and 0.92 respectively, and highly specific with a score of 0.91 and 0.88 respectively. In a final study and recent study by Almasi-Daghi et al. In 2016, however, the carpal tunnel compression test was found to be most suitable for carpal tunnel syndrome. The calculated sensitivity and specificity for the carpal compression test was 80.6% and 52.9% respectively. The validity or sensitivity and specificity of the Phalen'sTest was 59.7 and 35.3% for the Phalen'sTest. And for the Tinel's test, it was 65.3 and 47.1% respectively. However, we have to consider that validity was calculated using electrodiagnostic testing as the gold standard and not nerve conduction velocities. In summary, there are a broad range of sensitivity and specificity scores for this test. Some limitations I acknowledge is there seems to be some confusion as to what the gold standard for carpal tunnel syndrome examinations are. There's also high level of subjectivity in the Phalen'sTest. Patients have to report their symptoms, and that results in a high level of subjectivity. Finally, this does not take into account other differential diagnoses that could be associated with these symptoms, such as cubital tunnel syndrome or cervical radiculopathy, or other reasons why the patient may experience peripheral nerve symptoms. In future research, we could do another latent class analysis where we observe all the supposed gold standard tests. Finally, we can compare the use of more than one clinical test, so combining the tests to see if they are better at ruling in or ruling out specifically carpal tunnel syndrome. Here are my references, and thank you.